Senate Republicans are going to try again. A last resort effort to repeal Obamacare is in effect. But can they shore up enough support this time? A vote is expected next week on new legislation put forward by Senators Bill Cassidy and Lindsey Graham. This one still not getting Rand Paul's seal of approval.
This is not repeal. This is not what we promised. And the thing is, this is not the last chance. We will have many more opportunities. Obamacare is unwinding, and there's nobody for repeal more than I, but I can't vote for something that's not really repeal.
President Trump calls the bill great and says Rand is a friend, but singles him out as a, quote, negative force when it comes to fixing health care. Here's more from earlier from the president.
I think there's tremendous support for it. I think it's actually much better than the previous shot, which was very sadly let down. I think a lot of Republicans are embarrassed by it, but I have to tell you, I think they're going to do a great job. If this happens, it will be a great thing for the country.
Former President Obama sounded off today on the new attempt to overhaul his signature legislation.
When I see people trying to undo that hard-won progress for the 50th or 60th time, it is aggravating. And it's certainly frustrating to have to mobilize every couple of months to keep our leaders from inflicting real human suffering on our constituents.
All right, let's begin with Rand Paul, Kimberly. I don't think there's anything you can do besides fully uprooting Obamacare from the ground to please the senator from Kentucky.
I know, that's the thing. But you know what? He holds his ground on principle.
You have to respect that.
He does. So he said, look, he's being consistent.
Right.
He said, and every time I will offer an alternative in case somebody would like to choose that instead, because I feel that this isn't sufficient. So if you like someone who stands on his principle, okay. But if you want like, hey, a team player in the huddle.
That's not Rand.
But he voted for it 2 weeks ago.
So now let's see what happens. But today he's saying, listen, he has no bid for it. So I'm not sure that he's going to go for it at all. But the president, I think in kind of one of his most kind of charming ways to call someone out. You know,
he's my friend, but.
But he was like, said nothing's going to kind of please him. He's been tough on this, but we really should do this. This is our chance. So it's sort of like, come on. You know, the clock is running out. This is the chance for the GOP to deliver in a serious way what's been promised to the American people. You can't sit there and criticize President Obama and Obamacare and say that you could do it better and then fail in this measure over and over again. So this is kind of their last-ditch effort, but I think the expectation level is a little bit low, so perhaps they're going to exceed it.
Well, one, if Obamacare was working, the Republicans wouldn't have to repeal and replace it at all, would they?
He thinks it is working.
I think it is working. And so here's why Republicans have to repeal and replace.
Is it working, Juan?
Yes, it is working. More people
working
have
for the insurance companies.
No, more people. In fact, the insurance companies are the ones who have to get subsidies and bumpers and all to try to keep it working. So, but a minute ago, you said it was working for the insurance companies.
Yeah, because they're getting free money.
No, they're not getting free money because guess what? There are more Americans insured. They were able to, in fact, give Americans guaranteed against positions like pre-existing conditions.
Then why are they leaving the exchanges?
Well, some are, not all. And
most are.
Oh, actually, no. In a third of the counties in the country, actually, they are completely leaving
And you know why,
exchanges.
Kennedy? Because there's uncertainty caused by Republicans, including President Trump.
Well, they were leaving before Trump was elected.
Unfortunately, the system created the uncertainty.
No, I don't
and that's a problem, and it's incredibly cruel to say that Obamacare is working, because if your premiums have gone up 116%, like they have in parts of Arizona, saying that it's working for you, that's not working. Forcing you to pay for insurance that you don't need, that's not working. There are young people in this country, young, healthy people in this country, who only want catastrophic insurance. They can't get that under Obamacare, so they would rather pull out of the system entirely. And that causes a great destabilization, and pay the penalty and just go uninsured.
They have to pay a penalty. So that's part of the equation. The fact is that you see more people with insurance. You see consumer protections for people who have pre-existing conditions. You see Medicaid expanding. You see, in fact, the growth of a healthcare system that is market-based, Kennedy. And so you're saying,
forced entitlements, that is not growth.
Premiums.
That is not a free market. That is not a symptom of a healthy economy.
What is not?
having the federal government prop up insurance companies to the tune of billions of dollars. And that's exactly what would happen if Lamar Alexander and Patty Murray kept going down their bipartisan path in the Senate. I'm actually happy they're not. And, you know, this is what I will say about Rand Paul, and you pointed this out, Kimberly. There are people who listen to what the president said when he was on the campaign trail, agree with him or not, but he said, I'm going to build this wall. That's a man of principle, promising something, trying to deliver. That's exactly what Rand Paul is doing. It's the same idea, the same mechanism, the same principled action. And therefore, I don't think you can criticize and write him off for that.
Because I really don't know. Why did he vote for the bill 2 weeks ago then?
This is what I think, and I don't want to speak for him because the skinny well, as his self-appointed spokesperson of the evening, the skinny repeal bill actually was meant to be gutted. You know, it was meant to be completely hollowed out, and it was going to be a sort of Franken bill that was not going to resemble itself at all by the time it got to the House.
And I think that's what
like
people fear.
Skinny girl margarita.
Fact, you have a situation where Republicans aren't sincere about this. I mean, Kimberly said at the very start, is this, maybe it was you, Jesse, is this a bill, as was promised over 7 years, 50 or plus votes, that's better than Obamacare? Well, answer, 60% of Americans say, no, let's keep Obamacare and fix it, make it better at this point. Republicans are intent on some kind of political victory because they have none. And they say, oh, let's push this in the week, even though it's not better for the American people.
Well, perhaps one of the ways to make it better is to do what America does best, which is to take it out of Washington, D.C. and let the states decide. This is a bill that would just go back to federalistic principles. And one of the hang-ups is that the Congressional Budget Office hasn't scored it, meaning they haven't said how much this will cost. Well, I can't imagine what the guys at CBO are trying to do. How do you know what 50 different governors and citizens of those states are going to decide?
You don't.
You don't.
And how do you know how insurance companies, to your point, how do you know how they're going to react, how they're going to raise premiums, and how that is going to affect the market and the number of people insured?
Yeah. And just so the audience knows, I guess what you do is you keep Obamacare, all the taxes and the regulations, but you just take all the money and send it to the states, and then they can decide within the state how to deal with it.
There's a complication as well with that because 5 Republican governors have also explained and voiced their displeasure with trying to manage. They don't want to take on the burden of managing government health care that they think perhaps might not be run optimally.
And then is it going to have
the burden
to change
falls onto them.
Every time a new governor is elected, they're going to tinker with it again?
Right. A little bit complicated.
Yeah, so what you get here is you also put a cap on Medicaid spending because you're giving this money to the states, but then you put a cap on the spending. That does away with the guarantee to help pay for a share of the health care costs for low and moderate income Americans. That's a big burden then potentially on the states. So essentially what you have the Republicans at the moment doing is say, we don't know a form of a better health care plan. Their plan, the last plan, the so-called skinny plan, I think, as you said, Kenny, was intended to implode.
Yeah.
They
well, I don't know
have
if
a
intended
better
to implode.
plan.
It was intended to metamorphosize.
To go away. To go away.
It was intended to be.
So now they're saying, so we don't have a better plan. I tell you what, we'll shove it down on the states and let the governors do it.
Okay, but what if there's something about a federal bureaucracy? What if there's something about a centralized system that makes it very inefficient to get the necessary help to people who need it most? And we see that happen all the time.
And that's
so
why
what if
Murkowski
states
said she could, if the states were given the flexibility, then Senator Murkowski said that's something I could sell to the people of Alaska.
Right.
Yeah, but she's given, in fact, what we see is the people of Alaska will get less money under this new plan, so they will have less
but more
capacity.
Flexibility?
But they have less money. The governor, Senator Murkowski, will have less money to help.
But maybe that's what matters.
Maybe costs go down.
The decision making and more flexibility in terms of where their dollars go. Perhaps people are into that.
Yeah, and you know who's not into it? Jimmy Kimmel. Very, very upset. We know the backstory. He had a young son who needed a lot of emergency surgeries, and he did a huge monologue that got a lot of attention. And one of the things he wanted, if anybody's in his position but doesn't have Kimmel money, that surgery should be covered. He spoke out about this new repeal bill effort the other night.
They're not taking care of you. They're taking care of the people who give them money, like insurance companies. Most of the Congress people who vote on this bill probably won't even read it. And they want us to do the same thing. They want us to treat it like an iTunes service agreement. And this guy, Bill Cassidy, just lied right to my face.
Bill Cassidy was the sponsor from Louisiana. He was on the show. He is responding to Mr. Kimmel.
He is wrong. It will increase coverage and it will protect those with pre-existing conditions, particularly for those states who have not had the benefits of Medicaid expansion. We help those in those states, and those are millions of Americans.
You think Kimmel's being helpful to the debate?
I think everybody has a right to say what they think. I do think that there are times when, and I do this too, when you talk to somebody who has had a personal experience with something, you tend to listen to them.
Yep.
Because they have a compelling story, it is moving, and you think, gosh, there's a good point there. But that's not the best way to make public policy writ large. And Cassidy from Louisiana, he is a doctor himself, and he spent years working in charity hospitals. This is not somebody who is just basically trying to, like a get-rich-quick kind of doctor. So I think that there's a lot of momentum this week. Well, maybe it lasted 48 hours for this bill. Now the Congress is going home. And can they withstand the pressure from something like the Jimmy Kimmel appearance last night, the Facebook comments that will go around to all of the people,
President
and the
Obama
calls and
weighing
everything? Like, can they withstand that and come back and vote for it next week?
But you bring up a really good point, and that's charity hospitals. And that's something that we don't talk about, because some of the very best care in this country comes from places like Shriners and St. Jude's and, you know, the various children's hospitals
like
across
the Children's Hospital in L.A.
Yeah, and if you talk to people who've done surgical residencies, they will tell you they work in county hospitals. And there are so many surgeons who do a lot of pro bono work. And those are some of the most challenging cases where they actually learn the most. Any child who goes to the hospital who has a life-threatening heart condition who needs surgery is not going to be turned away. There's something in this country called the Hippocratic Oath. And, you know, if you talk to one of my very best friends is the head of pediatric cardiothoracic surgery in Arkansas. And what he does in taking those lives and those tiny hearts into his hands, it takes so much dedication and hard work and guts and grace and a soul. And those are the human beings who would never turn away the kind of people that Jimmy Kimmel is talking
about. Your friend
about.
Rand Paul's a doctor, too.
Yes,
and he's saying no. And not only that, the Hospital Association is saying no.
He's
the
an eye doctor.
What?
He's an eye doctor.
Yes. Okay. So the Hospital Association is saying no. The AARP is saying no. The AMA is saying no. I mean, there's
all those groups said yes to Obamacare, and then it imploded.
It did not implode.
Yes, it did.
This is like
we're in the death spiral, and you're not even paying attention.
This is like, you know, conservatives say something to each other back and forth. And they say, "Oh yeah, it must be true."
No, but those are the facts.
The facts
is Obamacare doing
the
well?
facts is that it's more people insured.
Yeah.
Premiums, Kennedy said, going up, but not at the rate they were going up. And in fact,
well, he said that he was going to lower premiums
when the bill was
and less
put in
doctors
place.
taking those patients. And in fact, for example, on some of the Obamacare plans, and I'll use not my own personal story, but somebody that I know, they are independent business owner. They have to buy on the Obamacare market. They have a pre-existing condition with a back condition. They need MRI. There is not a doctor on the island of Manhattan who will see him. So he has to take a day off of work, go to the Bronx. It's triple the money that he used to pay. The deductibles aren't there. And it's not like it's working perfectly, because even Hillary Clinton said during the campaign, I'm going to have to try to figure out how to fix this if I'm elected.
I agree. And that's why I would say, why can't
And
people
Bill Clinton
of good
said
faith
more
and
than that.
sincerity work on this together instead of this last-minute rush to somehow give a political victory, when in real life, real people...
Oh,
pass something on a party line vote?
Yeah, it's because it's Washington, D.C., Juan.